I'm Dr. Joanne Wilson from the Duke University Medical Center in Durham, North Carolina. In the next few minutes, I'm going to guide you through this procedure so you understand how a colonoscopy works and why it's used in situations like yours. I'll also acquaint you with what you can expect before, during, and after this procedure. A colonoscopy is a procedure where we look inside the colon. A well-trained physician called a gastroenterologist performs this procedure. The colon or large bowel is the last portion of your digestive or gastrointestinal tract. It's a hollow tube about 5 feet long. It starts at the cecum where it attaches to the end of the small intestine and ends at the rectum and anus. Its main function is to take water out of the stool and store unabsorbed food products prior to elimination. A colonoscopy is an important way to check for colon cancer and treat colon polyps. Polyps are abnormal growths on the inside lining of the intestine and vary in size and shape. While most polyps are not cancerous, some may turn into cancer. However, it's impossible to tell just by looking at the polyp. Colonoscopy is a safe and effective way to evaluate problems such as blood loss, abdominal or rectal pain, and changes in bowel habits such as chronic diarrhea. It may also be used to investigate abnormalities that may have been detected by other studies such as CT scan. Colonoscopy can also identify and treat active bleeding from the colon. It's often used to perform a polypectomy, a technique by which polyps are removed. The main instrument used to look inside the colon is a colonoscope. The colonoscope is a long, thin, flexible tube with a tiny video camera and a light on the end. By adjusting the controls on the colonoscope, the gastroenterologist can carefully guide the instrument in any direction to look at the interior of the colon. The colonoscope offers a high-quality, detailed image of the area being examined, which is viewed on a TV monitor. Another advantage of the colonoscope is that other instruments can be passed through it. These instruments might be used to painlessly remove a suspicious-looking growth or polyp, or biopsy a piece of the colon, which is taking a small piece for further analysis. These added procedures may help to avoid surgery or better define what type of treatment may be needed.
Mr. Holmes?
Hi.
Hi, welcome. Sandra Goller, I'm going to be your nurse.
Great, nice to meet you.
There are important steps that you need to take to prepare for the procedure. First, be sure to provide a complete list of all the medicines that you are taking, including over-the-counter medications and natural supplements. Also, inform your doctor about any allergies that you have to drugs or other substances. Your medical team will also want to know if you have heart, lung, or other medical conditions that may need special attention before, during, or after the colonoscopy. It's especially important to let them know if you take anticoagulants, sometimes called blood thinners, or medications for a diabetic condition. You'll be given instructions in advance that will outline what you should and should not do in preparation for colonoscopy. Be sure to read these instructions well in advance of the procedure and follow them carefully. It's very important that you thoroughly clean out your bowel before your exam. For many patients, this can be the most trying part of the procedure. However, it's essential that you complete this step carefully. How well the bowel is emptied will help to determine how effective your doctor's examination is during colonoscopy. Various methods can be used to help cleanse your bowel, and your doctor will recommend what he or she prefers in your specific case. Often, a liquid preparation designed to stimulate bowel movement is given orally. Additional approaches include special diets, such as clear liquids, or the use of enemas or suppositories. Whatever method or combination of methods are recommended for you, be sure to follow the instructions carefully. Your doctor will instruct you on what to eat or drink the night before your colonoscopy and when to stop eating. You should also discuss with your physician which of your medications you should or should not take prior to the procedure.
Okay, great.
Good morning.
Hi, how are you today?
All right, how you doing,
Your
ma'am?
colonoscopy can be performed in a hospital, an outpatient facility, or in your doctor's office. You will be asked to sign a form verifying that you consent to having the procedure and that you understand what is involved. If there's anything you don't understand, ask a member of your medical team for more information. During the procedure, everything will be done to ensure that you will be as comfortable as possible. An intravenous line or IV will be placed to give you medication to make you relaxed and drowsy. It will enable you to remain awake and cooperative, but it may prevent you from remembering much of the experience. Once you're fully relaxed, your doctor will first do a rectal exam with a gloved, lubricated finger. Then the lubricated colonoscope will be gently inserted. As the scope is slowly and carefully passed, you may feel as if you need to move your bowels. You may feel some cramping or fullness because air is introduced to help advance the scope. However, there's usually little or no discomfort. Colonoscopy is a safe procedure. However, on rare occasions, complications can occur. For instance, there might be a perforation or tear of the colon walls, which could require surgical repair. When a polyp is removed or a biopsy is performed, heavy bleeding may result. Sometimes this requires a blood transfusion or reinsertion of the scope to control the bleeding. Be sure to discuss any specific concerns you have about the procedure with your doctor. The time needed for colonoscopy can vary depending in part on what's found and what needs to be done. On average, the procedure takes about 30 minutes. Afterwards, you'll be cared for in a recovery area until most of the effects of the medication have worn off. At that time, your doctor will inform you about the results of your colonoscopy and provide any additional information you need to know. You will also be given instructions regarding how soon you can eat, drink, take medications, plus other guidelines for resuming your normal routine. By the time you're ready to go home, you'll feel stronger and more alert, but you shouldn't drive, so you'll need to have a family member or friend take you home, and you should plan on resting for the remainder of the day. Occasionally, minor problems may persist, such as bloating, gas, or mild cramping. These should disappear in 24 hours or less.
Hello, Dr. Wilson. How are you?
After you're home, you will receive further information regarding your procedure if any tissue has been removed. The important thing to remember is that colonoscopy is a safe and effective procedure to evaluate your colon, screen for colon cancer, and in many cases improve your digestive health.
Hello, I'm Dr. Lynn Butterly, and I'm here today to talk to you about taking the prep for your colonoscopy. You may have heard from many people that the preparation is the worst part about a colonoscopy, and for the vast majority of people, that's true. Therefore, we're here today to talk about some tips and suggestions that might make it easier for you to take the preparation for your colonoscopy and to do a good job, which is extremely important. Colorectal cancer is the second most common cause of death from cancer in the United States. Only lung cancer is more common in men and women combined. On top of that, colorectal cancer is one of the few cancers that we can actually prevent. There are two major concepts in terms of cancer prevention. First of all, you're also going to be on what we call a clear liquid diet. Examples of clear liquids that you do want to have on hand would be, for example, apple juice, white grape juice, ginger ale, other clear drinks, Jell-O, broth, bouillon. Those are really good because if you feel cold while drinking the prep, some broth or bouillon may help you to feel warmer. Some hard candies to suck on in between taking glasses of the liquid, and anything else that falls into a clear liquid category. If you have questions, your endoscopy center can tell you what constitutes a clear liquid and what doesn't. Other things you might want to have on hand are plenty of toilet paper, because this prep does involve spending some time in the bathroom, a magazine or book that you like, any special wipes to use if you feel that those make you more comfortable as you go along, and anything else that helps you to feel comfortable. It's only a few hours and you want to make them as easy as you possibly can. In general, the way people take the prep is to drink 1 glass every 15 minutes or so until they begin to feel full. Most people do begin to feel full after a number of glasses, and at that point, it's sometimes helpful to just pause, take a break, stop drinking for a while. You can walk around, take your time in order to help the liquid to pass on through. If you continue to try to force the liquid down when you feel really full, it can result in nausea or vomiting. That does happen sometimes, but this is one way in which you might be able to minimize that from happening. As you begin to work your way down through the jug, you will begin to notice as you pour glass after glass that fortunately the amount remaining is getting less. However, as people get about halfway through sometimes, they sometimes can feel discouraged. It feels like a lot to do. Just remember, the end goal is to have your colon be really clean so that the doctor can find all the polyps there are. So don't get discouraged. Take a little break. Walk around if you need to, and then come back to it. And you will know that taking the prep and having a successful colonoscopy has got to be easier than getting colorectal cancer. So keep that in mind. Try not to get discouraged. You will make it to the end, and when you do, your colon will be clear. Now, there's some other tips about taking the gallon jug if that's the prep that you're taking. And one of those is to split the prep in half. So half the preparation the afternoon and evening before the test, and the other half or part of it the morning of the test. Not every endoscopy center gives these instructions this way, and it is important to follow the instructions that you are given. But if you are given instructions for a split prep, that may help you, because what you will be doing is working on cleaning out the colon the night before, trying to get a decent night's sleep. There is liquid that reaccumulates overnight, and therefore taking a few glasses in the morning can help to get that last bit of liquid out. Remember to give yourself plenty of time for this, because you're only drinking every 15 minutes or so until you feel full, taking a break, and then taking the rest. And also, you want to finish the preparation an hour and a half to 2 hours before you leave the house, because you want it to move through you while you still have a bathroom handy, and not while you've gotten in the car and are driving an hour and a half to your colonoscopy. So keep that in mind, that finishing the prep well before leaving the house is another helpful tip. Now, in addition to splitting the prep into 2 sections, you want to keep the end goal in mind. The end goal is that what you are passing should look pretty much like what you're drinking. If you are passing brown fluid of any kind, your colon is probably not cleaned out enough, and it would be a good idea to contact the endoscopy center for instructions. If you are drinking the second half of the preparation on the morning of the test, which you will finish well before leaving the house, then your goal is to have what you pass when you go to the bathroom look like pretty much what you're drinking, or slightly yellow tinged. Not brown, no food particles, no other kind of particles, but clear. One of the things that you can do if you don't like the taste of the liquid is to flavor it with a flavoring such as Crystal Light, which is available in any grocery store, comes in different flavors. You want to avoid any red or purple looking liquid the day before the colonoscopy, only because we want to be sure that nothing appears to be blood in your colon if there's no blood there. That's the reason that your instructions will probably say to avoid red or purple liquids. So keep the goal in mind. It is to prevent you from getting colorectal cancer, and that's worth it. So here's to your health.